Hi everyone and welcome back to the Chemist Couple podcast with your hosts Lee and Jess. We are both clinical pharmacists who work in GP practices in the northwest of England, and the aim of our podcast is to provide evidence-based advice, personal experiences and create awareness around long-term health conditions. We hope you enjoy the show. Okay, so this week we're going to be discussing national screening, and we are aware that it is a sensitive topic because we will be discussing cancers and it does affect a lot of the people that will be listening to this. And as always, our podcasts and shows are for informational purposes only. We will be using information from the Cancer Research UK website, NHS England, the Gov website, and all the data that we have enlisted today are correct as of the filming date today. And it doesn't substitute seeing a medical professional. So would you like to start?
Yeah, so I was just going to start by asking, why do we have screening?
So we have national screening because we are aware of all these conditions that can come out. So we're going to focus on a few cancers today. And there are some cancers that are not covered. We will bring up prostate cancer being one of them. And it's where we found a test that can identify the cancer early enough to then lead to beneficial treatment without over-diagnosing or causing unnecessary harm to people.
Yeah. So like you said, we're going to discuss 4 today, and 3 of them are on the national screening. One of them isn't, like you said, prostate cancer. So do you want to start with breast cancer?
Yeah.
Yeah. Okay, so breast cancer screening is for anybody in the UK of between the ages of 50 and then up until your 71st birthday. So patients who fall into this cohort will be called up every 3 years. The screening test involves a mammogram. So that is basically a machine where the breast goes into it and then it screens and scans the tissue within the breast. The mammogram is then performed on both breasts, and then each mammogram is done twice. Then once you've obviously had that, you will then get your results through. If there's something abnormal that is found on them, then further investigations will then be done.
Yeah, so why do we do breast screening? So it is the most common form of cancer in the UK.
It is, yeah.
It does affect 370 males each year. And in terms of general diagnoses, there's over 56,000 people, which leads to over 11,500 deaths. So we've found that mammograms do prevent 1,300 deaths annually. And it is a beneficial tool to use because if you look at the 10-year survival rate, we are looking at 76% with breast cancer.
Yeah.
Oh, go on.
I was going to say the stat that I found the most staggering was that 1 in 7 women will experience breast cancer at some point in their lives, so that is quite high. So obviously it is important that we are screening for this. And
who should go for, well, like you said, it's from 50 until 71. They are looking at some study called the Age X, which is trying to lower the age to 47 and increase it to 73 to see if it is of any benefit. Now, over the age of 71, you can request the screening like you would have done in the years previous, and you can do that every 3 years still. But this doesn't mean if you are younger that you can't go for some sort of assessment, which is what I'm going to go into now in terms of what symptoms would you need to have to pursue this review. Yeah, so it's usually any changes in your breast. So it could be a lump that's come up within your breast or under your arm. If you're not breastfeeding or pregnant and you're getting nipple discharge, that could be something else. A change in the nipple in terms of colour or size could be an indication of some type of breast cancer. There is something that on the NHS website that says if it goes like the texture of an orange, so it's kind of dimply, that could also indicate it. Is there any others that I haven't mentioned? Rash, redness, yeah. That is one of them. But they're the main, that's with a lot of the symptoms that you're going to hear today, a lot of the symptoms are non-specific. So if you do have a lump, for example, and you're a young female, it doesn't mean you've got breast cancer. But also, on the other hand, it's not something that you should neglect and ignore because it could be glandular tissue that's grown in size, for example. There are so many different causes of these symptoms, which is why the screening programs are in place at certain ages as well, because breast cancer is more common later on in life, etc. Yeah. So from a personal point of view, I actually had a lump in my breast earlier this year, which I went and got checked out by the GP, was referred on a 2-week pathway, which means that it was suspected cancer. And due to my age, they actually can't do mammograms on younger women. That's because your tissue tends to be more dense. So when they're doing a mammogram, it doesn't show up as clearly if there was something to go wrong.
So they did an ultrasound on me. It turned out to be fine. There was no cause identified, but it potentially could have been to do with stress, but we just don't know.
Of course,
But my mum and my nan and my mum's mum have had cysts that they've had removed. So maybe I'm at a higher risk of that. I don't know, but obviously, for me, I found the lump, and then it was important to just go and get checked because it was
that's a
painless.
peace of mind.
Yeah, it was painless. I was in and out. They were really lovely in the centre where I went to, and yeah, I now have peace of mind that I know that there was nothing sinister going on.
Yeah, and just for those, a mammogram is an X-ray, and it normally takes half an hour, and it will be by an appropriate gender staff. That is something that we need to make clear. It's not that you will go in there and there'll be someone that you don't feel comfortable with. They're very professional, normally very knowledgeable in this area anyway. They put you at ease and you're in and out.
You can always ask for a chaperone as well, so if you feel like you want somebody else within the department in with you, you can ask for that.
Yeah, and there are ways of opting out of screening. It's not a requirement. Like with anything, with your health, you have the autonomy to make the decision yourself. But in terms of why you would opt out, for example, if you're in the younger years, you could have just given birth. You could have had recent trauma, recent surgery, for example, so you could have a temporary opt-out form. And that's the most important part, is that you make sure you opt out in what relation to your circumstances, because you can, for example, if you've got a severe health condition and it's a best interest to not, you've had a previous mastectomy, both bilateral mastectomy, you can then opt out permanently. So you will not show up in any national screening systems. Yeah.
I think an important point to make as well is that if you do opt out for whatever reason and you want to opt back in again, just make sure that you check the protocol for that. I'm pretty sure that you probably have to maybe do a written consent to opt back into it, so just bear that in mind.
So that's breast cancer. Again, everything that we've said will be on the Cancer Research website. We come across that, and I mean, it's a sad read, because the only reason you would be on there is either you've got someone affected by it or you are a healthcare professional looking at it. The data is easy to follow. There's diagrams on there, there's videos, there's a lot of infographics. So if you do know someone who's affected, that is definitely somewhere where I will go to. So the next topic is bowel cancer.
Bowel screening.
Do you want to go through that one?
Yeah, so bowel screening is used to detect bowel cancers. They're also known sometimes as colon cancer. So cancers which affect the large bowel. And anybody between the ages of 54 and 74 is eligible for this, and it's usually every 2 years. The NHS long-term plan does incorporate this to be rolled out to people above the age of 50, so I think they're in the process of doing that. The test is a fit test, which means that it's a stool sample that you will send off. When you get the fit test, there's instructions on them that document clearly what to do, so it is quite easy to follow. And then I think it's 2 weeks after you've done it, and then you'll receive your results.
Yeah.
But bowel cancer is the 4th most common cancer in the UK.
Yeah, it's the result. 42,000 people are diagnosed annually, over 16,000 deaths. In terms of its 10-year survival rate, it is lower. I believe it's towards 51%. So it is a bit more serious. But like you said then, the test is a fit test, which is different from previous generations. So it used to be called a fecal occult blood test, and that changed in 2019. And that was, we've had personal experience anyway, but that's where you had to do 3 stool samples over a couple of days, and then you had to take a sample from it, and it would react with a chemical. And now they found this new test, which is more accurate. It's got less false positives, meaning the results are more accurate in terms of they don't mislead you in the same way they did previously. And you come up with a number now as opposed to like a quality, well, it's called quantitative now, where it gives you a number, as opposed to qualitative, where it was an interpretation of the results. But like you said, it's every 2 years that you do it. The test is easy, as long as you make sure you write down the date of the sample on it. Any further tests normally lead to colonoscopies. That's normally about 2% of the people who take the test. Yeah,
I was going to say that even if you do get a positive fit test, it could be a whole host of different things. So it could be polyps, which are growths in your bowel, which they do need to be checked. So that's just another thing to know, but they're not cancerous. usually. So it could be something to do with that. It could be IBD. It could be that you've had a recent infection.
Yeah. Could be trauma, surgery.
Yeah, if you've got like anal fistulas, or if you've got even hemorrhoids, it can all cause a positive fit test. So I know that I had a patient yesterday actually who he was on the bowel screening. His fit test had come back positive, and he was worried that meant that he had cancer. Obviously, I had to explain to him that it doesn't mean that you have cancer. It means that you will need further investigation to rule out that it potentially is cancer.
Yeah, I mean, I had a positive fit test in January.
I feel like we've done everything.
Yeah, apart from the last two, luckily. But yeah, I had a positive fit test in January. Again, it was due to stress-induced colitis, I believe. I think that's what we come up with. I had to go for a colonoscopy. It's not the worst thing in the world. Obviously, it's a bit foreign to me going through that process, but again, like you with the screening and the ultrasound, it's peace of mind at the end of the day. Sadly, like with all tests, it doesn't mean it's going to capture everyone with cancer. So my nan, she sadly passed away coming up to 20 years next year of bowel cancer. She was only mid-60s. She done the fecal occult blood test, which I said changed in 2019. Hers come back as fine.
It's negative.
Ended up coming up as stage 4, and within 3 months of diagnosis, she'd sadly passed away. But that's the whole point of these national screening. Try and catch it as early as you can. Yeah. But it is taking it with a pinch of salt.
And I was going to say, we didn't mention that with the breast screening, but with all of these screening protocols, it doesn't mean that it is going to capture every single person. There can be false negatives. Yeah. So that's just another thing. If you do have any of the symptoms of these cancers, then it is important to push for further testing when necessary. Yeah. If even if it comes back that it is false, if it continues, if you have a change in bowel habit that's been continuing on, if you have, you feel a mass in your stomach, if
you've got blood in your stools.
Yeah, if you've had any unintentional weight loss, these are all signs that it could potentially be bowel cancer, so don't ignore them signs.
Yeah, I was going to go through them, but you've done, and then you've got lethargy, and you have
anemia,
bloating.
Yeah.
So again, it's very non-specific, which is hard. That's why you need to go for these tests, and I know some of them aren't pleasant. The colonoscopy, like we said, that's the next step if your results come back abnormal or do you want to look into it further. If you've got something called Lynch syndrome, which is something you want me to look into, which is where you've got a genetic risk of cancers due to other things within the family, for example, you would bypass the fit test from what I know, and you would go to colonoscopies every 2 years purely because you are higher risk as a baseline. Yeah.
So, I mean, just to touch on Lynch syndrome, like you say, it is a genetic variant that increases your risk of certain types of cancers, and not many people know about it, but there is a national, I think, screening for that as well. So you can refer yourself, or your GP can refer you if you think that you may have it, and you can get genetically tested, because like you say, you are high risk, and so there will be more monitoring put in place for you.
Yeah, I wasn't even aware of it.
No, yeah, I wasn't until you went through what you've been through, because the most common types of cancer, if you do have Lynch syndrome, and it'll be within your family, is prostate cancer, bladder cancer, stomach cancer, bowel cancer, and then in very rare circumstances, it can be skin cancers. So that's just another thing to think about, because it's autosomal dominant, which means that if one parent carries the genetic variation, then 50% of their offspring will carry the gene. So it is
quite serious,
if you do have it. So.
Okay. I mean, we're going to go back over the main stats at the very end of this, just to touch upon the age ranges. But like we said, if you fall out of it and you've got them symptoms, even if you're 30, go to the GP. They said for 3 weeks, 2 to 3 weeks.
Yeah, if you've got change in bowel habits or any of the other symptoms.
I would definitely be in touch with someone a bit sooner than that and see what they do, because it's all down to local protocols and down to your family history. Yeah. So it will change.
I think if you think about it, if you do have blood in your stool, it can look quite scary. So I think a lot of people will probably refer or self-refer earlier than the 2 to 3 weeks, I could imagine.
Yeah, it depends on volume as well. It doesn't say, but if it's a small, minute volume, you might miss it. But if it is large volumes, you will normally go to A&E. Now, the next one is cervical cancer, which it's normally the most common in 30-year-olds.
Yeah,
in
30 to
terms of
34 is the most prevalent of the
yeah, and I think the
cancer.
biggest thing for this one was on the cancer research website. It said it's 99.8% preventable
Yeah.
through vaccines and screening, which is scary really because we've got that tool, we've got them things to use at our disposal, so we should do.
Yeah.
But despite that, there is still over 3,200 diagnosed each year, which is leading to over 850 deaths.
Yeah. I
Which is
think
sad.
it is, and I think there's a stigma around it because it's just smear, this one. So young girls will know what that, if you say smear, okay, I know what that means. There is a stigma around it where, because of the age of the people who are being tested, so between the ages of 25 and 64, tend to be younger, you feel more embarrassed. I know that all of my friends were, whenever we got called to go and get our smears, we were like, oh, what was it like? And you do get hype it up, and you feel nervous for going in. And trust me, that is the worst part, because the actual procedure is painless. It takes about 5 minutes, and the nurses that do them have usually been doing them for years. So they're so discreet and they're just lovely about it.
Yeah.
And so there's nothing to be worried about. And like you say, it's 99.8% preventable. So if you just go and get your smears, girls.
I know. So I was going to go on to what the test involved. I've never had any experience of it, but it's a speculum, which is a plastic device which is inserted, and then a soft brush is inserted through this device, and it just is brushed against the cervical area to collect some cells. They then go off. They then look for HPV, which is human papillomavirus, and then from there they determine what needs further testing. Again, it doesn't mean you've got it at that point. It just, something might be a bit obscure. And that's all it is. It takes a couple of minutes. It's normally by, again, a gender appropriate member of staff and well experienced, well trained, put you at ease.
Yeah, they're so discreet about it. Like I say, you've got a cloth, like a blanket over you. So they literally just get it in and out, and then it's done. And like I say, it's painless. And even though, so I got my HPV vaccine, it doesn't mean, if you've had it, it doesn't mean that you're protected against it. You still need to go for your smears.
Which is the same with every vaccine. You have the flu vaccine. It's just the idea that it builds up immunity within your body, so that if you ever do encounter this pathogen, you do have a defence there already. Now, who gets tested? So you said it starts at 25 to 64.
Yeah.
Until the age of 49, it is every 3 years?
Yep, every 3 years, and that's because you're more likely to develop cervical cancer at a younger age, which is different to most other cancers, but which is quite interesting. Yeah. And then anybody over the age of 49, it's then every 5 years up to the age of 64, and then you can opt in again after the age of 64 to have it, can't you? Yeah,
and that's the same with all the screening programs, that you can continue to have this monitoring at that frequency.
Yeah.
There is one thing I do want to say is it depends on where you live within the UK, how frequent the cervical monitoring is. And I believe Scotland is every 5 years. Don't quote me on it, but that is something, especially once you hit that age, you should be looking within your local area how often I can get cervical screening. Yeah. Like we said, it's a utensil there that's going to prevent you having a serious cancer, and it is preventable, so why not? Because, like we said, there's still 850 people that die each year, and it is a 51% 10-year survival, so it is serious once you get to the end stages of it. Yeah. Symptoms for people who, again, if you fall out of this age bracket, even if you do have the requirement in the age bracket, what symptoms should you be looking out for? So
it could be like unexplained vaginal bleeding. So if you're not on your period, or you're not menstruating, and you're getting bleeding outside of that could be a symptom. If you're having pain during sex, or if you've got just a dull pain or a pain in your pelvic area, that could be a symptom. Yeah,
vaginal discharge.
Yeah.
Again, non-specific. It could be numerous things. Could be trauma. It could be a bacterial infection. We've got to get this looked at. Yeah. Haven't we?
And then I was just.
You're going to say when's the best time to go and get checked? Yeah. It was only because you brought it.
Yeah. No. So I was just going to say the best time to get checked is when you're not menstruating. I think it's just to do with obviously cleanliness, and then also probably the actual sample and maybe contaminated and stuff. So so if you obviously get an appointment through and you are due onto your period, then just rearrange it, and they'll be happy to do that at your GP surgery. You would usually wait as well 3 months after if you've given birth, 3 months after you've had a termination of a pregnancy or a miscarriage.
Yeah, and it's 2 days either way for your period. So 2 days at least before and at least 2 days after it. And then that also goes for any infections that you're being treated for at the time. Give that some time to reside, and then you can go for the screening. But yeah, and now the last subject is prostate cancer.
Well, I was just going to say,
no,
sorry,
go
just
on,
before
sorry.
we go on the cervical screening, some patients who will have had a hysterectomy may think that they no longer need to go for cervical screening. You have to just check whether you got a total hysterectomy, which will have been removal of the cervix and the womb, or whether it was a subtotal. If it was a subtotal, you still may have your cervix intact, so you would still need to go. And then the same goes for trans men or people who are non-binary. So at the moment on the GP systems that we use, the cervical screening tool cannot pick up those patients. So if you are a trans man but still have a cervix, you won't automatically be called up to go for screening, and so you would have to ask for it yourself if you would like to go for screening. Yeah,
and that's to clarify if you've still not had any operations, and non-binary if you were assigned female at birth.
Yeah.
And that also applies for breast screening.
Yeah.
The system that we use EMIS. The system one out there, they may not pick it up like you just said.
Yeah.
Is there anything else?
No, I think that's
No, I missed. That's a very important part, to be honest. Now, prostate cancer, there is no screening program for this. There are 11 national screening programs. Prostate cancer isn't one of them. And it's not because it's any less significant than the other cancers. It is the biggest cancer in men. It still leads to 12,000 deaths annually, and over 52,000 people are diagnosed each year. Men stereotypically are poor for going to the GP, especially with intimate reasons. They're always scared of the examination. So the reason why we don't have national screening for prostate is the test, which is called the PSA, which is a prostate-specific antigen, is released by the prostate throughout the whole lifespan, and it ironically gets more, well, in terms of secretion, it increases as you grow older. So if you have a blood test and it comes back with a higher value, it could just be that your prostate's enlarged naturally with age, which is BPH, benign prostatic hyperplasia. So when they actually look at the stats in terms of this national screening tool, as opposed to the benefits it would convey, it's limited. Because a lot of men would then lead to unnecessary biopsies, unnecessary treatments. And prostate cancer is quite unique in terms of you can have active surveillance, meaning you've got the prostate cancer there, but we can just keep an eye on it. We don't have to intervene at that point. So with all that said, there's a few things you do need to know in terms of symptoms, when you can request tests, and how you go about it. So until you get the age of 50, you can then request a PSA blood test. Like I said, interpretation needs to be against your own bloods, because a normal PSA can then, in 25% of cases, still lead to a cancer diagnosis at the end of it. Symptoms that you would look out for are difficulty in urinating, an incomplete feeling of urination once you've finished. Then you've got blood in your semen or blood in your urine. You can have an increased frequency to urinate. And these are all non-specific symptoms, and a lot of men might be like, oh, I potentially got it. It's always worth having a trip down to the GP. Now, the exam that a lot of men fear is the DRE, which is a digital rectal examination, and it is basically the practitioner feeling the prostate to make sure there's nothing untoward on there. That's normally more reserved in terms of it used to be first line. It's sort of been set back. The PSA blood test is put first. But if you were to have a suspicion, you would go through that. You would go through ultrasounds and go through the cascade that way. Now, things that will interrupt and alter your PSA tests include a previous vigorous exercise in 48 hours, previous ejaculation within the 48 hours, if you've had a digital rectal examination that day before you've had the blood test, recent trauma, stress, they can all influence it. So again, with anything, you've got to take it with a pinch of salt. Is there anything else you want to know about that one?
No, I don't think so. I was just going to say, with all of these screenings, I think a lot of people may feel nervous or don't want to go for them because they're quite intimate things. But it's just important to note that the people who are doing them are trained health professionals, that this is literally what they've trained for. So don't be worried about going for any of the tests, because they see it all day, every day. It's nothing new to them, and something that, you know, is worrying you, they've seen it all before. And if it could prevent something, you know, any of these cancers, then it's 100% worth it. So just don't be worried, or try not to be worried about it, because yeah, it's you know, it really is second nature to all
You would
these
rather
people
them
doing
2 minutes of embarrassment, 30
Yeah.
minutes of embarrassment, which isn't embarrassing.
It
It may
shouldn't
be
be.
to you as a patient, and we understand that. But
Yeah.
like you said, it's everything we've seen. And if them 30 minutes of embarrassing yourself puts another 10 years onto your life, you
Yeah.
know, the trade-off is obviously worth it.
Yeah.
Now, going through, I just want to go through the main ages again. So we've went through all the stats, who's affected, what symptoms you should look at, but I want to go through the main age range of when the testing applies, and then what symptoms you should look for if you fit out, well, if you don't fit into these ranges.
Okay.
So breast cancer is from 50
Yep.
until your 71st birthday.
Yep.
You can, again, request it after this, like with all the screening programs. If not, the symptoms you should look out for are...
So a lump in your breast or in under your arm, nipple discharge if you're not breastfeeding or you're not pregnant, a change in your nipple shape or the colour, just a general change in your breast. So you could have dimples, things like that.
Yeah, redness, change in nipple position.
Yeah.
Have you said discharge again?
Yeah.
Yeah. So again...
And it's every 3 years.
It's every 3 years, that's the main thing. Now, the next one is bowel cancer. Now, I know we didn't touch on it as such. If you actually look on all these websites we've looked at, it's quite conflicting in terms of what age it may apply, but 54 is the one that we are agreeing on at the moment with the plan to go to 50.
Yeah.
And it's from 54 all the way up to 74.
Yep.
It's a fit test, which is sent to your home.
Yep.
It's every 2 years.
Yep.
It's a stool sample. And then symptoms to look out for are changes in bowel habits. You've got bloating, any lumps or masses within your abdomen. You've got blood in your stools. You've got an incomplete feeling of evacuation after you've been in the toilet. And
unexplained weight loss.
Unexplained weight loss and lethargy.
Yeah. And then sometimes you can have an anemia, but that would be identified on a blood test. So you wouldn't particularly know that if you didn't have your blood taken. Then
we've got cervical cancer, which is from the age of 25 up to 64.
Yep.
Now, depending on where you live in the UK, from 25 to 49, it's every 3 years, after which it's every 5 years. Again, you can still request this if you want after this age period. Now, with breast cancer, if you're a trans male, or you are a non-binary assigned female at birth, you still need to fit into this national screening if you haven't had the relevant operations. And the symptoms that you look out for are...
So unexplained vaginal bleeding, it could be vaginal discharge, pain during sex, or just pain in the pelvic area.
Yep. And then the last one is prostate cancer. Not a national screening programme, but if you're over 50, it's worth adding it onto your blood test if you feel you want to go down that route.
Symptoms of it, yeah.
Yeah, symptoms normally are difficulty in starting to urinate, weak stream, for example, an incomplete feeling of bladder emptying, you've got blood in your semen or within your urine, and the last one is increased frequency or urge to urinate. And yeah, they're the main ones we wanted to cover. There are, again, there's 8 other national screenings that we haven't gone through. We just picked them because
I think as well the 8 other ones off the top of my head are more unique to individual patients. So it could be patients living with other other long-term health conditions such as type 2 diabetes, whereas this actually is available for almost everyone who fits into them age categories. So that was the difference between these ones, wasn't it?
Yeah, and we also wanted to look, because we've had a lot of questions from patients, when do I fit into this regime, when can I go for this test? It's always good to know. It's always moving the boundaries to trying to find better tests.
And also like increase the ages and decrease the ages of who can be screened. Obviously the ultimate goal of this is to prevent as many cancers as we possibly can.
And with life, you are not going to have a perfect result. You are going to, sadly, people will slip through the net despite going for regular testing. There are going to be people who are overdiagnosed, on the other hand, and gone through treatment that they necessarily wouldn't have warranted. But this is something that you've got to take with a pinch of salt, because it is a population-based cohort, isn't it?
Yeah.
But one thing I would say, if you do have them symptoms, don't hold back.
No.
It's not embarrassing. We see these all the time in surgery and in clinics, and it's nothing to us.
No.
That's one thing I would say.
Yeah, it's second nature. We see it a lot, and we would rather patients come in and get it checked you know, than not, and worry about it. But yeah, no, thank you for listening to the podcast. As always, if you have any other questions that we haven't touched upon in the podcast, then drop us a message, let us know. And also, if there's any topics that you would like us to discuss in the future, again, just let us know. This will also be going up on YouTube again, so if anybody's listening to it on Spotify and would prefer to see it as a video format, then you know, head over there and make sure that you subscribe and like the channel, because we would love that.
And we are going to link everything below in the description, all the sources we've used, and where you can go to if you need any further help. If you need further help, that's also probably a good place to start. But yeah, thanks for listening.